Good morning and welcome to the Audit and Performance Committee of the Perth and Kinross Integration Joint Board. Today is Monday the 28th of November 2022. Can I first start by welcoming you, and can I just say at this meeting it's important that we acknowledge that this is Jane's last meeting with us, so if you want to make it as difficult as possible, please feel free to do so. Just a bit of punishment for leaving us all. But we'll make some comments at the end of the meeting, but just like to acknowledge Jane, good luck for your last meeting, and we appreciate you being here. So moving on from that, can I just also mention that Donald McPherson, who was at the last meeting as one of the Tayside Health Board members, has now moved on, and we will be confirming at the next meeting of the IGB who his replacement will be. But I'm gathering we're still quorate enough to move ahead with the meeting today, so I'd like to acknowledge that. Have we any apologies?
Thank you, Chair. There's no registered apologies here, but if anyone does know of any, probably now would be a good time to say so. Thank you.
Any apologies that the members know of? Nope. Okay, we'll move on from there. Next part of the agenda is the declarations of interest, and members are reminded of their obligation to declare any financial and non-financial interest which they may have in any item in this agenda in accordance with the Perth and Kinross Integration Joint Board Code of Conduct. Any declarations to declare? Nope. Oh, easy so far. Right, minute of the previous meeting. Could I take the minutes for any comments, amendments, suggestions, please? Nope. Okay. Could I have a proposer for the meeting? Anybody?
Happy to propose.
Thank you.
I'm happy. I was going to say I was happy to propose, but I can second if somebody else has proposed.
Okay, thank you, Sheila. And can I pass on my thanks for the minute taker of this meeting? It was quite a long, complex meeting, and I think the minute very accurately and succinctly reflects all that. So thank you very much, Phil, for that. Okay, moving on to the action points update, and this is where I'm happy to start handing things over to people. So action points update, Jackie and Jane, I think are going to take us through, I think, action points 5 and 5.1 around the development sessions. Jackie, you wanted to take that?
Yeah, happy to do that. Thanks, Chair. The first action point, reference 50, is about an IJB risk workshop and a development session, and that's been pushed over till January. Similarly with action point 51 in relation to a development session on clinical care governance, and I think it's probably helpful to push those events over to January, given the change in the committee membership as well, Chair. So that's there. And then I'm not sure if Jane's got an update on 52.
Thank you, Jackie, and thank you, Chair. Yes, I'm delighted to say that I've just had a message through in the last 2 minutes from my colleague Dave Berry in Dundee IGB to confirm that their accounts and their annual governance statement within that were approved at the end of last week with no issues arising. So we will get formal confirmation of that by way of a letter from Dundee IGB, and that will be circulated.
Thank you very much for that. Okay, that takes us through if there's any other matters arising that anybody wants to raise. Nope. Okay, we'll go on to the meat of the agenda then. The next item is the financial position, and Jane is going to update us for the 6-month position to the year-end outturn. Jane, could I hand over to you, please?
Thank you, Chair. The paper circulated sets out and reminds members that the 22-23 financial plan approved by the IGB in March forecast a core £1 million overspend across health and social care. The main driver of that was GP prescribing, and the use of general reserves was approved to deliver break-even. The latest financial position, based on the 6 months to 30th September, forecasts an overspend of £0.4 million, therefore an improved position on plan. The constituent parts of that position, there are a number. Overall, there's been a positive movement in the core position in terms of operational service delivery, where we were forecasting an overspend, and we're now forecasting an underspend. That movement, that £1.9 million movement in the position, is significantly driven by slippage in investment, by improved position on prescribing, but offset by higher than anticipated pay price costs, most significantly driven by a provision for the local authority pay increase. The forecast £2 million slippage on delivery of approved savings is consistent with the approved plan. However, the change in treatment by the Scottish Government means that that's no longer able to be absorbed against COVID reserves, and therefore the underspend on the core position is allowing us to offset that slippage which we were anticipating. COVID costs are forecast for the year end. They've reduced from £5.7 million at month 4 to £4.8 million at the end of month 6. We've taken significant time to review our forecast based on year-to-date expenditure and continuing guidance from the Scottish Government around chargeable expenditure. The report also provides a full update on the IJB's reserves. Taking account of planned expenditure and Scottish Government pullback of reserves, a balance of £2 million of earmarked reserves is anticipated to remain at the end of the year. Over and above this, £5.1 million of unearmarked reserves are anticipated to be carried forward. This gross figure equates to 2.2% of the budget. The IGB reserves policy sets out the need for a minimum of 2% unearmarked reserves to meet unplanned costs. As we come forward to the IGB in December, we'll be seeking to update members on the draft budget proposals. Those include a number of non-recurring costs which are likely to bring that uncommitted reserves balance down to just in line with the 2% reserves policy. I'm happy to take any questions on the detail of the core operational position reserves, or indeed COVID expenditure. Happy to pass back to the Chair.
Thank you, Jean. Have we any questions or clarification sought from anyone? Nope. The one thing I was wanting to ask is, how do we anticipate the slippage? I mean, a lot of the slippage and some of the projects is around difficulty in recruiting staff, etc. Do we anticipate that that position is going to improve?
Yes, I mean, with the report in front of the committee today is based on month 6. We already have a draft month 7 position, and we can see that the huge efforts across services to recruit to those planned increases in capacity is having an impact. So we are seeing that an improved trajectory in terms of slippage on investment, although you know, we're not going to suddenly see the 2 million disappear, but it is going in the right direction. It's coming down rather than going up.
Any other questions? David.
Okay, thank you. One of the issues in there is prescription costs. What can we do to resolve that?
So I'm hoping that Hamish Dougal, my colleague is on the line. Hamish works very closely with us around the GP prescribing. What we know that costs, the item costs for prescribing and the volume of prescriptions is very variable. We know from looking again at month 7 that we've seen a big shift in prescribing from the position reported to the committee today, and item costs are going up. And there'll be a number of factors driving that. Many of them will be national issues driven by kind of nationally negotiated prices. However, the work that we established a number of years ago, the Quality, Safety and Efficiency of Prescribing programme, which we are in the middle of reinvigorating, does look at the ways in which we can do exactly that. We can target through different approaches to quality and efficiency, and we can target areas where we can reduce costs. Hamish, I don't know if you want to say anything further.
I'm just noticing in the chat, Chair, that Hamish is trying to get into the meeting and our colleagues are trying to bring him in, so there may be technical issues there.
We can perhaps, when Hamish joins, come back at an appropriate point and ask for an update.
Thank you. Yes, David.
Okay, thank you. Paragraph 3.6 talks about 2C medical practices in Dundee and Angus, and conversations are going on with Dundee and Angus IJBs. How are those conversations progressing?
Jackie, do you maybe want to pick up on that one?
Yeah, thanks very much. The 3 chief officers meet regularly, Councillor Illingworth, and my most recent update from the chief officer in Angus, who has the lead role for hosted services, has given an indication that the costs in relation to 2C practices is looking positive in this financial year. So we'll bring more detail forward on that in due course. I think Dr. Dougal's now in the room. In the online meeting.
Okay, thank you. Hamish, I'm going to hand over to Jane and David. They've been asking some questions around prescribing costs. So if we could hand over, Jane, to some.
Good morning, Hamish. We've been talking about the costs of prescribing. I've been updating in response to David's question, the fact that we are seeing some costs increase. Some of that's driven nationally, but there are things that we can do locally, and our refreshed Quality, Safety and Efficiency Prescribing programme does try to tackle areas of high cost. We wondered if you wanted to give an update. I know you've done some recent work just looking at costs and have been looking at the restart of the QSET programme.
Yeah, let me just, I'm just going to get the up-to-date data that we've got that I sent up to you recently. Our QSET programme has been somewhat in abeyance because of changes in personnel and people moving on. We had hoped to recruit a pharmacist to the QSET team, but we weren't able to appoint. We interviewed last week, but weren't able to appoint, and we've also lost our program managers in relation to that. So I'm slightly behind. You've taken me slightly on the back foot here. I'm just looking for the data. Yeah, so we keep, there has been a bit of a backlog from NHS Tayside in getting data. They were 3 months behind because of problems with reporting. So I chased them up last week and got the report, which is what I shared with yourself and others in the executive team. Having looked through all the detail, we get lots of different prescribing reports, and having looked through the detail of the many thousands of things that we we prescribe in P&K. I'm not seeing a clear trend to why our costs are going up. We're not out of line with Scotland. There's been item growth, which we'd expect given population changes, although that's slightly ahead of where our population changes would be. I'm just looking for the cost. But one of the things we compare month on month is how our figures are comparing to the rest of Scotland. And so we're not particularly out of step with that. Here we go.
Are you happy with that, David? Okay. Anything else, David,
yeah,
you wanted to?
It's a really difficult question to answer in one or two sentences because it's so complex. But yeah, so I've probably not given you a very clear description of it at the moment.
That's great, Hamish. Thank you. I think David's happy with the answer. Sheila, I've been told you want to. Sorry, I can't see any hands or
That's
anything.
okay.
So Sheila, you want to give us a comment, please?
Yes, really, it was just a comment on the reserves and the attainment of a 2% reserve position. I just want to commend the financial team and Jane in particular in the challenging circumstances that we all find ourselves in, that we're able to achieve that and have confidence that we will maintain that going forward. I think it's crucially important that we do stick with that 2%. I think that's probably the minimum we should have. So I just think it's a good job, and to thank everyone for all the effort they've done to try and achieve that. Thank you.
Thank you, Sheila, and I think we'd all endorse that. The one thing that keeps coming to my mind between winter statements in December from the Scottish Government, etc., we just don't know what's going to change. So it's really important that we get this good advice and keeping up to date with the current position. Anything else before we move on from this? Nope. Well, we've been recommended to note that the overall projected outturn is 0.4 million overspend with a requirement for the use of general reserve to deliver financial balance. We note the forecast of 4.8 million COVID-19 costs, which are funded in full by the IGB COVID-19 reserve. We also note the update regarding the IGB reserves position for 22-23, and we note the extent of the financial risks that may still impact on the financial outturn in 22-23. So thank you for that. Next, we're moving on to the progress report for the key national indicators set. And Chris, I'm told that you're going to ably take us through this paper.
Thanks, Chair. Yes, happy to do so. So this, I'll just get the report on my screen. Thank you. So this report updates the committee against, in respect to performance against the core set of national integration indicators. These measures are determined by the Scottish Government and are those that are required to be used for the purposes of integration reporting. I thought that was important to just bring to the committee's attention, given the number of changes that have been with committee membership. So just a reminder in respect to why we use these particular indicators. The data that's provided in today's report substantially comes via Public Health Scotland, and it comes ahead of official Public Health Scotland publication of data. The reason that that's important to note is that because we're bringing that to the committee ahead of time, ahead of the official publication, it is more subject to change than other data. The alternative approach here is that we wait for the official publication, which would mean the lag in the data is significantly greater. So it's a balance of risk around bringing data forward, which is hopefully usable and gives a sufficient level of assurance in respect to progress, while not unduly delaying the publication to this committee. In terms of variance, the bits of variance that we may anticipate to be more prevalent would be in relation to comparisons to our peer group and Scotland overall. As you would expect, those data sets are gathered and presented by other boards across Scotland, and so we've got very little control over the extent to which that data is complete, but nonetheless it's here for the committee's overview. Turning to the overview and performance, compared to 2021, our performance is mixed. Compared to Scotland overall, in respect to in-year, our performance is again mixed. If we compare performance to our peer group, we can see that it's not favourable with a number of indicators beyond the 6%. I think it's 5 indicators beyond the 6% target range. Performance has varied from the target most in respect to indicators relating to emergency admissions, the rate of emergency bed days, rate of falls resulting in an emergency admission, and delayed discharges. It's notable that in contrast, however, accident emergency attendances do compare favourably, and the rate of readmissions has improved from 2021-22. Happy to pause there and take questions.
Anyone online, any questions, comments for Chris? Okay, is everybody quite clear and comfortable that they know who our peer groups are? I think Chris conveniently put in the appendix the other areas that are our peers across Scotland, which is a group that we are compared with in these national indicators. Okay, no questions?
So
I think
can
it's...
Can I ask a
Yep.
question?
Yes, Sheila.
Hold on a second to get this right. Yeah, so in terms of hospitalisations and stats relating to stays in hospital and into A&E, is that at the hospitals within Perth and Kinross, or is it within hospitals within that we access?
Thanks, Councillor McCall. The data relates to the patient, not the location.
Okay.
So you'll have patients here that will be in 9 Wells, for example, and elsewhere.
Okay, thank you.
Okay, thank you. I suppose I would just like to comment that I'm pleased to see, having managed palliative care services for a number of years, that we are still doing very well, and the palliative standard of people being able to spend time at home in the last 6 months of life. We could go into detail and supposition about where we are at the moment, but I think we're all clear about our current position and challenges.
Thanks, Chair. It was the only thing I wanted to add. Apologies for not doing so in my introduction. It was just to say that this report follows a pattern of bringing forward reports in relation to these national indicators on a regular basis to the committee. We will, however, as we look to bring forward additional performance update reports in relation to our strategic delivery plans, the committee will be aware that we've got the community mental health and wellbeing report will come forward in December, will be presented by Chris Lamont on that basis, and there's performance related information in there as well, and we'll look to move to supplement these particular indicators with a broader set related to the delivery of those strategies.
I'm watering on there. I think that's really helpful, Chris, and I think it's also something that we'll be able to pick up with the key indicators in our discussions in January about how we're going to set our own key measurements and whether where they're all placed within their set of tasks. No one else got anything else they want to add before we move on? Okay, well, the committee will note the Health and Social Care Partnership's performance to date against the key strategic indicators. Okay, moving on to governance and assurance. Strategic risk management update. Jackie, will you be taking us through this one, please?
Yeah, I'm happy to introduce this one. Thank you very much, Chair. This is the Strategic Risk Management Update for the Audit and Performance Committee. The Strategic Risk Register, as you know, examines the risks for the IJB's ability to deliver on its strategic commissioning plan. And the Audit and Performance Committee has delegated responsibility for reviewing the adequacy and effectiveness of the systems in place to manage that strategic risk. The Health and Social Care Partnerships Management Team routinely monitors and reviews the strategic risks for the partnership, and that also includes clinical and care risks. So in this period, you'll see that the risk score for the financial resources risk, that's SR01, has been increased from 20 to 25. And you'll see that there's also a re-escalation of the corporate support risk, and that was archived back in August. And as a result of the current financial position from 23-24, we're having to consider the significant budget challenges that will lead to or may lead to, and therefore the ongoing recruitment to new and additional posts that are not associated with frontline delivery are currently paused in some areas, and this is one of them. So that's an area that's been escalated and is now re-emerging in our risk register at SR10, and that's in line 8 in the table. So the committee are being asked to note the strategic risks register and note the new and emerging risks and the changes to existing risks in this paper. Thank you.
Thank you, Jackie. One of the specific risks that have been highlighted was the prison healthcare. Could you give us an update on the status around that, just to make clear?
In terms of the prisoner healthcare and pharmacy? Yeah, I wonder if Hamish is able to say something on that, because I think Hamish has got more detail than I do.
Sorry, Jackie, I lost the audio there, so I just heard at the end of it, prisoner healthcare and
the issues around pharmacy and the risks around pharmacy.
Yes, this related to a national contract with Lloyd's Pharmacy and their change of IT system. It was sitting as an amber risk, it's now been downgraded to a yellow risk, and is as a thought of a number of the mitigations put in. This has been led nationally across the whole of the prison service across Scotland, because it's a national contract. And Lloyd's had until the middle of September, they had 8 weeks to produce significant changes. That has been extended to give them more time to do that. But in terms of the risk currently in the hosted services in Perth and Kinross and Tayside, we feel that those are being managed adequately, but it still remains on the risk register.
Okay, thank you for that, Hamish. Anyone in the room got any questions, clarity required? The only other thing I was going to ask Jackie, there was a bit of discussion at the last meeting about the internal audit looking at the corporate. Is that going to be taken into account with the increase in the risk?
Yes.
Of the... Okay, thank you.
Yeah, yes, thank you very much, Chair. I know that Jackie Clark, the internal auditor, has a report on later, which sets out her continued intention to scope out some work in relation to that. I was just also going to make a comment, if I may, Chair, while I'm live on screen, in that I think there may be a slight typo in the table, which is table 1, where the in terms of SRO1 financial resources, I think it mean the impact and probability. Impact is 5 and probability is 4. I think it should be 5 and 5. I just noticed that in preparation for today.
Yeah, thank you. Thanks for pointing that out, Jackie. Okay, any other questions from anyone online? Nope. Okay, thank you. Well, the committee's been asked to approve the IJB Strategic Risk Register and Strategic Risk Improvement Plan, and to note the current position of IJB Strategic Risk Exposure as at Section 3. So I can confirm that. Okay, thank you. Now moving on to 5.2, Internal Audit Report, Primary Care. Hamish, stand by. Jackie, welcome.
Thank you, Chair. Yes, this is an internal audit report on primary care. The findings detailed within the report were first circulated as a draft report in May of this year to officers, and work has been ongoing to agree the actions since then, and this work is continuing. As this has been an outstanding report for some time, and it was presented to NHS's Audit and Risk Committee earlier this month, it is brought before you as a draft final today. When it is finalised, I'll share the final version with members of this committee, and I'll provide a commentary on any significant updates to the Audit and Performance Committee following its finalisation. The scope of this report, which is tabled today, is significantly broader than that which was approved by this committee. The scope that was approved here was to provide assurance to Perth and Kinross's IJB over the arrangements in place for the implementation of the Primary Care Improvement Plan. You'll note specifically about the work that was commissioned by you on page 4 of this report, which is page 69 of the pack, that reasonable assurance can be placed on the systems of governance, risk management and control in this specific area. Page 26 of this report, which is page 91 of the pack, details the commentary of the findings in relation to this part of the audit. And this includes the findings about the current position and also some next steps. I'd hoped that Gail Smith, the Chief Officer of Angus IJB, in her role of overall primary care within Tayside IJBs, would be here to introduce the report and to answer any questions, but unfortunately her diary wouldn't allow for that. However, she has undertaken to answer any specific questions on the wider aspects of this report, if any are forthcoming from this committee. But the actions which are currently in draft are for her to lead or to oversee, rather than arising from the part of the audit which related to Perth and Kinross's primary care improvement plan. I hope that provides a bit more of a context to the report. It is, there's quite a lot in this report, a lot of which I've not had sight of because it was not commissioned by me. So I will answer what I can. Maybe Hamish Dougal could answer for some other areas, but I will certainly ensure that the Chief Officer for Angus IJB can answer anything else, but just unfortunately not today.
Okay, thank you, Jackie. It was interesting, the report was complimentary about Perth and Kinross and where we were sitting. Hamish, not wanting to put you on the spot, have you got any comments you'd like to make on this report? I know that I've found quite confusing how it's been distributed, being on the audit and risk at NHS Tayside. I managed to see it but I wonder if you'd any comments from your perspective from Perth and Kinross side?
Yes, gosh, where do I start? I think when you read this report, you'll perhaps understand the complexities of the current arrangements for primary care. I'm pleased, Chair, that you picked up the fact that there's quite a thread through this report of the fact that Perth and Kinross is, there's many examples of good practice and innovation in Perth and Kinross. My own observation is that when the IGBs first came into existence, primary care was differently organised. There wasn't a primary care improvement plan, so the primary care improvement plans are operational implementation through funding directed to the specific partnerships rather than to NHS Tayside. So that is a circa £4 million budget per year, which we didn't used to have. So there's much more operational involvement than when the IGB was established. And I suppose I still have a question as to where is that best organised and managed, and what is the utility overall of having a hosting or lead partner arrangement when so much of it is now integrated into all of our community services, from the front door of the hospital to the front door of the GP practice. There's lots in between now. So I think the EMT for PK hasn't had a proper chance to fully respond to the management responses in this, but I think we would certainly want to see it broadened slightly to include, what is the utility of the current arrangement going forward, because it is a complex structure.
Thank you, Hamish. Any questions for Hamish or Jackie, indeed, or Jackie? Jackie or Jackie? Any questions firstly in the room?
I have, oh, sorry.
Oh, Sheila, please come on.
Thank you. This is quite a report, I have to say, and like you, I've had some sight of it before. I think there's two overriding things that strike me about it, apart from the fact that Perth and Kinross IGB is doing some good practice, particularly in the primary care improvement plan. I think the question I have really is, what can we do within Perth and Kinross IGB to address some of the audit findings, or what are we doing? I recognise that Angus has a lead on this, but nevertheless, what are we doing to make sure that we are addressing where we can the audit findings, audit recommendations that are pertinent to us?
Hamish, do you want to take that one?
Do you want me to respond to that? There are so many recommendations there, Councillor McCall. I wonder which ones you particularly relate to. I think a lot of this report pertains to structure.
I was thinking about, yeah, I'm thinking about process and various things like that, to say, are our processes robust enough? Is our communications robust enough? And have we done some sort of sense check ourselves?
I think the report goes into the fact that probably a lot of the communication that we have across primary care and Tayside is through good working relationships rather than necessarily good structure. And I think that's one of the challenges the report brings, is to say, well, what is the right structure for this? There's recommendations around the primary care board, which is pan-Tayside, and the suggestion that should have further delegated authority. Given that there's been a change in the way that, because primary care previously was hosted strategically and operationally from in Angus, however, operationly, Perth and Kinross was almost entirely independent. So that's why there was this disconnect that was noted in the report. Whereas now it is simply a strategic lead arrangement. So if the operational is sitting with the different partnerships, then I'm not quite sure what the purpose of giving delegated authority to the primary care board would be. So I think there are a number of structural questions, which are fundamental questions that I think need to be discussed. And my own wish is that we look at what is the best way to deliver the services that our patients need, and not how necessarily we fit into a structure that's that we are inheriting historically.
think that's really the answer I was looking for, because like, you're absolutely correct. There's so many recommendations. I tried to put it all into one question, which probably maybe wasn't as helpful as it could have been. But I think we need to make sure that we're able to respond, and we have the structures as well as the people in place to be able to do so. Thank you.
Thank you, Sheila. Hamish, can I just ask a specific question? At the audit and risk in NHST side, Gail was present and we were able to ask her a few more questions directly. But I think one of the things that I want to be assured of from a Perth and Kinross perspective, do you feel you're fully engaged in this debate and discussion? Do you feel that we are able to engage and influence around the future of the primary care structures in response to this audit report?
I would like to see better engagement in that. I'd like to see a bit more blue sky thinking, as I've answered to Vince McCall, in terms of what is the right structure. I don't think we've had great proactive engagement at the moment, but perhaps because this report hasn't been finalised, or perhaps there hasn't been the opportunity to do that. But I would welcome a greater engagement and more robust discussion on the subject.
I think it's important that we do feed that back then before this is finalised, to try and make sure that that's maybe taken account. Jackie, I don't know what you think of that.
I think that would be really helpful, and yes, I will certainly feed that back through the internal auditors as well as direct to Gail when I contact her after this meeting.
Okay, thank you for that. The other Jackie, are you happy with that?
Yes, absolutely, because I think the discussions that are flowing and continuing from the revised integration schemes are really pertinent here, because we know that we've got the two arrangements in terms of the lead partner role for strategic planning relates to mental health services and primary care and GP services. So and that's still developing, but so I think we need to use the discussion that we've just had to continue to inform that. So I know that you'll feed that back, Jackie, in terms of your role, and I'll pick that up in terms of my ongoing engagement with the other two chief officers.
Thank you for that. Any other comments before we move on? Okay, so we've been asked to note the contents of the draft final report, the wider review of the strategic risks related to primary care, which incorporates a review of the Perth and Kinross Primary Care Improvement Plan. Final report will be shared with members of the committee at the earliest opportunity, and any significant amendments to this report and action plan will be reported to our next meeting. We're happy with that. I keep looking at David in the room. Okay, thank you. Jackie, can we move on to the internal progress report, please? Audit progress report.
Thank you, Chair. Yes, this report just details the progress that has been made since the last Audit and Performance Committee around the completion of work in relation to the approved internal audit plans. We've obviously covered one significant part already from last year's plan. And from the appendix, you'll note that the leadership capacity and sustainability of commissioned service providers has commenced in terms of planning, and we're moving towards commencing the actual audits, detailed audit testing in that area as well, with the final audit, which has been approved in relation to premises, that is due to commence after the Christmas break. I'm happy to take any questions or comments, but that's the update for this committee today.
Okay, thank you. They're all at a pretty early stage in the process for questioning, I suppose. Anyone in the room? David, have you got anything? Nope. Anyone online got any questions on this topic?
I have one, please.
Yes, Sheila?
Thank you. It's on the sustainability of commission service providers, and that the planning has commenced, and you're coming back to, oh no, it's February 22. I thought it was February 23. So when is that due to come back to us?
That should be hopefully at the next meeting. That's
February 23.
Yes, that was a
So the follow-on question to that, if I may, Chair, is what will be coming back to us in February 23? Because I think there's a lot of commission service providers to get round if we're still only at the planning stage.
There's a review on how we are managing that. The only thing which may cause an issue with the report coming forward is within Perth and Kinross there is a transformation and change review on procurement and commission services. So that this there may be some work that's going on there which may influence the work that we're doing. It is in planning at the moment, but we're once the scope is agreed, then testing will go forward. We've got a couple of months to go through that. I know there's Christmas in the middle, but that should be okay.
Okay, thank you. Maybe if that typo can be corrected.
Thank you. Yes.
Thank you. Thank you, Chair.
Sheila. I think it's an interesting time through winter to be looking at our external providers. I think they will be quite distracted, but
I think that's my concern, really, Chair, is that there's already a lot of pressure on external service providers. Between like a lot of places at the moment, staff recruitment and retention, but also there's also an increased risk of COVID or winter flu or other types of things that may put other extra pressure on them and their sustainability. So, but thank you anyway. At least we can look forward to it in February, which I'm pleased about. Thank you.
Yeah, I think, Jackie, you've confirmed it's more about the procurement and the planning of the process rather than the actual third sector or providers themselves and their performance.
It is very much about the partnership staff's management of these of the arrangements that are in place, rather than actually doing an audit of a commission provider. That's not within the scope of this.
Okay, thank you.
Okay, thank you for that. Any other final questions around that? Okay, so the committee has been asked to note the progress made in the delivery of the, Jackie?
Yeah.
No, I think it was me, Jackie.
Oh,
and it was really just to pick up on the comments that being made about the commission services, and this very much came through the risks that we were identifying, particularly in care at home and in the care home sector, as a result of the pandemic and the pressures that have been seen across the system. So I think there'd be, just to note, there's a specific focus around those areas where we were identifying particular areas of fragility. So I would expect that the report that would come forward would be focusing in on that in particular. Jackie, would that be correct?
That's certainly a significant part of the scoping, yes.
That's helpful clarity. Thanks for that, both Jackies. Okay, so the committee is asked to note the progress made in the delivery of the 21-22 and the 22-23 plans. And again, I'll look at David. Yes. Happy to do that. Okay, thank you. Hamish, I'm beginning to feel sorry for you because we're now moving on to the clinical and care governance assurance. And I guess it's you. It could be shared with Kenny. So Kenny, do you want to start then and take us through this and give Hamish time for thought?
Yes, happy to do that and give Hamish a break. The purpose of this report is to provide assurance to the Audit and Performance Committee in respect of clinical care and professional governance arrangements that are in place for delegated and hosted services managed by Perth and Kinross Health and Social Care Partnership. A report went to the IGB in September of last year regarding clinical care governance assurance arrangements, and it was recommended that clinical care governance assurance is discussed at this committee. So terms of reference of this committee were amended accordingly, and this is the first report that's come since that report at the IGB. So the report is asking the Audit and Performance Committee to Firstly, note the responsibilities of the IGB in respect of clinical care and professional governance and those of the IGB's partners. Note the arrangements that are in place for providing the IGB with assurance that effective and robust systems of clinical care and professional governance are in place, and note the Chief Officer is confirming the effectiveness of these systems. The responsibilities of the IGB are stated in the report. The IGB has a strategic commissioning role with operational responsibility for delegated and hosted services resting within the Health and Social Care Partnership. And that brings together NHS Tayside and Perth and Kinross Council as the employing bodies of the staff delivering these services and fulfilling their respective statutory duties. The Care and Professional Governance Forum was established at the inception of the Health and Social Care Partnership, and it meets regularly. It's chaired jointly by the Clinical Director, and that's Hamish, and the Interim Head of Services for Adult Social Work and Social Care Operations, and that's myself. The forum provides assurance on the quality, safety and effectiveness of all services delegated to the Perth and Kinross IGB, and this is achieved through detailed annual reporting on all aspects of service delivery, which is linked to the domains of effective clinical and care governance and the health and social care standards. And there's also a monthly process for escalating any factors which may be inhibiting safe care. Issues and concerns are raised as required. We also note, discuss and examine mitigating actions for any risks that are escalated, and we obtain regular feedback regarding adult protection and complaints and any learning that may come from complaints. And the Care and Professional Governance Forum reports to NHS Tayside's Care Governance Committee, and that's with regular assurance and exception reports. And these reports seek to provide assurance to NHS Tayside that there are effective and embedded systems for clinical care and professional governance in all the services dedicated to or hosted by the IGB. However, it should be noted inpatient mental health and learning disability services and all general adult psychiatry medical workforce issues, they report directly to the NHS Tayside Care Governance Committee, as operational responsibility is not delegated to the IGB, it's retained by NHS Tayside. And as well as that, we've made some reference to hosted services already, but services hosted by Angus IGB and Dundee IGB also report directly to the NHS Tayside Care Governance Committee. We've now reached agreement for a reciprocal process for the provision of assurance to the IGB from Perth and Kinross Council for operational adult social work and social care services managed by the partnership, with reporting from the Care and Professional Governance Forum to the Scrutiny and Performance Committee, and the plan is for that to start early 2023. The Audit and Performance Committee on an ongoing basis, we're planning to continue to provide assurance that effective clinical care and professional governance arrangements are in place for operational services commissioned by the IGB and managed by the partnership. We're planning on doing that through regular sharing of the assurance and exception reports to the Care Governance Committee and the Scrutiny and Performance Committee. At one committee, it's a full report. The next committee, it's exceptions only, and then that cycle is repeated. And the plan is for the same report to go to both the NHS committee and the Council's committee. And that's what will be shared with this committee, plus minutes or the relevant parts of the minutes for Perth and Kinross. They'll also be forwarded to this committee. And again, just to the appendices, they are the minute of the last Care Governance Committee meeting where an assurance report for Perth and Kinross was presented. That's attached, along with an exception report which was provided to the Care Governance Committee on the 6th of October. So happy to take, or myself and Hamish are happy to take any questions from there.
Thank you for that. That was quite comprehensive, Kenny. Although I think the one thing that I would appreciate some clarity around is, I do acknowledge that the inpatients, for example, mental health, will be directly to NHS Tayside, and the Angus and Dundee hosted services don't come to our committees either. How do we receive assurance for the services that we use in those areas, such as primary care services, such as, you know, some of the interface with the inpatient mental health and our community services, and also, you know, some of the Dundee, which I'm trying to think, psychology service or whatever is being hosted. Will we get even an annual assurance report from those areas to try and give us that assurance? Because there are quite big areas, and it's the interface with our own areas that would worry me, that would need assurance.
I might bring Hamish or Jackie in on that one. I suppose one comment I would make, if there are any specific care governance concerns relating to any of those issues impacting on the IGB's responsibilities, they would be flagged up to the Care and Professional Governance Forum and would then come in through the report from the forum. But in terms of the wider reports, I mean, obviously these services you discussed, they do report directly to the Care Governance Committee. It may be possible to include the reports and any comments to the minutes and attach them to the appendix for regular feedback to this committee. I'm not sure, happy bringing Hamish or Jackie in that one.
I'm happy to come in if that's okay. Hamish, I think it would be helpful actually to a future meeting of this committee to share the flowchart, the diagram that you prepared in relation to mental health services, because that clearly shows the reporting lines in relation to clinical and care governance, and that would probably be helpful for this committee to see, Chair. And the arrangements that there are to ensure that there's a connectedness across that. I wonder if we can bring that forward in a future report, Hamish.
Yeah, I'm happy to do that. Can I just add in what Kenny said, that there has been quite a lot of discussion across Tayside about how the hosted reports and assurance is shared with the different partnerships. And it has been agreed that the annual reports that we have for each hosted service would be shared with the forums within each partnership. There is a danger that we then start scrutinising this in multiple different forums and that we increase complexity. So I think there's a sweet point that we need to find for that. So we wouldn't be looking to apply a huge amount of scrutiny in the forum where it's already being applied in other areas. However, it might be worth extending the extract minutes that we take from CGC in relation to our own report, which we will attach to the actual report to CGC. We could extend that extract minute to include those of the other partnerships or those elements where there is reference made to the things which are hosted elsewhere, if that would be helpful.
I think that would be helpful. I mean, I've no personal desire to scrutinise even more papers, etc. But I would like to be reassured that our clinical governance agenda have done that and that we're aware that that is being carried out. So something around that. But again, we could pick that up in January. I think there's a range of issues that we can have our development about around this topic. Thank you, Hamish. Thank you, Jackie. And thank you, Kenny. Any other questions? David, no? Any questions online? Sheila?
I have a question, if I may. Yes, on Appendix 2, the situation regarding prison healthcare and Lloyd's Pharmacy. I'm just wondering, is there any update to that can be shared at this time?
Yeah, I'm happy to do that. I think I reported on that earlier in the meeting.
Perhaps I missed it. I do apologise.
Yeah, no, it's okay. It was just that it was an amber risk. It's been downgraded to yellow on the basis of the extent of the mitigations that are in place. This is a national. This is an issue right across Scotland. Councillor McCall.
Can't hear you. Sorry, your sound's gone.
I think Hamish was just confirming that it was a national issue and not just a local issue, and it's being worked on and resolved across Scotland.
Well, that's better. Yes, thank you. Okay. And I just wonder, the Community Justice Partnership, is this being reported to them?
I'm not sure.
Does anybody have any ideas whether that has been reported? Jackie, would you know?
No, I wouldn't have thought that it had been, Councillor McCall.
We do have NHS representation on the Community Justice Partnership, and so this is quite significant. If I put my hat on for that particular committee, it's quite a significant potential impact to the work of that particular partnership. But I'll try and find out and take it offline. Thank you.
Yep.
Okay, is there anyone else online? I saw somebody's picture jump up a minute ago. Is that? Nope. Nope. No other points? No other points in the room? Okay, well, we've been asked to note the responsibilities of Perth and Kinross IGB in respect of clinical care and professional governance and those of IGB partners. We've been asked to note the arrangements in place for providing the IGB with assurance that effective and robust systems of clinical care and professional governance are in place, and to note that the Chief Officer confirms the effectiveness of the above systems in place in the IGB's partner organisations. We're happy to note that. Okay, thank you. Okay, we've rattled through that agenda, so well done everybody. I won't take any credit. We've just got a couple of issues for information, and then I'll take you through them. The P&K IGB Audit and Performance Committee work plan. I'm simply seeking questions or comments if anybody has for those papers. Nope, we'll note them. The Audit and Performance Committee record of attendance, just to make sure everybody's checked that they have been present and correct. Thank you. The only other thing to pick up was Phil had sent round the external audit information about projected costs. I think, Sheila, you very cleverly highlighted that at our last meeting, that you had this experience in another forum. And we have now received correspondence which confirms your fears about additional costs. I don't know if there's anything we want to discuss as a committee. Jane, have we got any powers to do anything about that, or is it something that we're just going to have to wait and bear when we get the costs back?
I think what the correspondence that was circulated highlights is there is going to be a stepped increase in overall costs that's now been agreed nationally. However, there is still within that, each auditor will come to each body to confirm that basic rate, or whether they're going to go for a kind of, I think it's a 10% over and above that increased rate, and that is where my successor will come to the committee to agree or to bring forward what is being proposed by Audit Scotland, who will be our new auditors, and whether they're seeking anything above the basic rate. But and so there will be a role for the committee in terms of basic rate or 10% above basic rate, but there is no influence that the committee can have now on what the basic rate is set at. That's now been agreed nationally, and it absolutely does reflect the concerns that Sheila raised. However, costs for the last 3 years have been pretty static, so a level of increase, would have been expected. So hopefully that's helpful, and good luck with your further deliberations around that in the next month or so.
Yeah, I think the issue that I'd had previously, just for clarity, was about the variable rate, and that there was no input from client side to influence that whatsoever. It was entirely at the discretion of the auditor, and so it was really just to bring the committee's notice to that risk, because 10% can be quite significant over time. I'm glad it's 10%. My experience in the past was greater than that, so but nevertheless it was just really to think about how do we make some provision for that, because the uplift was associated with the experience and seniority of the auditor rather than the audit work itself. So it's just to try and make sure the terms and conditions of contract and engagement put some possible controls around that. But at least we have clarity, which is good.
Thank you, Sheila. Well caught that one. Do we have any information on who our external auditor is going to be as individuals, and it's just for future meetings?
We've had no contact yet from Audit Scotland. I think Audit Scotland are still finalising audits from 21-22, and therefore may not have been able to kind of roll forward to their new clients. You know, for example, that was Dave Berry last week, who's Audit Scotland's his auditor, just finalising his accounts, and that's November. So things are running late. So I would imagine in the next few weeks, Audit Scotland will be in contact, you should certainly plan for there to have been contact by the next committee meeting.
Thank you. It's just when we look at the private discussion, we wouldn't want to put all that pressure on Jackie if we were just going to have a meeting with internal audit. But I think we agreed we'd maybe discuss whether we have that private discussion with auditors at our event in January as a matter of course or not. So we'll leave it this time. And the date of the next meeting, we've got a date in the diary for Monday the 13th of March. We don't have next year's programme of meetings in advance. I think we're still waiting on the IGB's agreed dates. Has anybody got an update on that, or are we just going to wait until we hear from the IGB?
Yeah, thanks, Chair. Yeah, basically there's no update on that at the minute. We've, as you quite rightly say, we'll be waiting on the RJB now at this stage, but I'm sure we can we'll flag it up and we'll commit to this. It'll be Adam. He'll get some dates around as soon as possible.
Thank you for that. So we'll confirm that the next meeting will be Monday the 13th of March, and we'll contact members about the development event in January. That kind of brings us to the end of the meeting. Thank you very much for your contributions. And just, I'd like to just personally give my thanks to Jane at her last meeting. I think I have only been in the chair for this is my second meeting. And it was only after my first meeting, at the end of the meeting, Jane took me aside and informed me that she'd been successful in another post, and I had a large gulp. But I would personally like to thank you for all your support in getting me ready for this awesome task. And I'm sure that I'm going to hand over to Jackie, because Jackie will be able to tell you a bit more about your contribution. But I know, just talking to your colleagues, brief occasions, how much they're going to miss you and how valued you have been as both a leadership and a colleague role. So I just want to personally wish you all the best, Jane, and I'm sure the committee does, and if we could minute that, and if we could maybe hand over to Jackie and then anyone else who wants to say anything for Jackie. Thank you. For Jane.
Jane. Thanks very much. I think Beth, in terms of your role as very new role as chair, already picking up on the valued support that Jane has provided to you, and I would echo that as being a relatively new chief officer. You know, the extremely knowledgeable and valuable support that Jane has given me. But in terms of this committee, because I think we'll get a chance to say more about that, because Jane will be with us for the next IJB meeting. But in terms of this committee, I know that Jane has provided a huge degree of expert and persistent support over many years, I think, Jane, to bring this committee to both, to be a working committee that has a great deal of accurate and careful reporting that coming forward, and a lot of that is down to you personally, Jane. So I would like to echo Beth, thanks to you, and just give some recognition to the work that you've done in the formation and the work of this committee in particular. And I think we'll get a chance to say a bit more about your support more broadly across the whole of the partnership in times to come. So thank you very much.
Thank you, Jackie. David, do you want to say anything?
Yeah, I haven't really known Jane that long, but I have been very impressed by the clarity and of her presentations and her knowledge of the IJB and her enthusiasm for everything that the IJB does. And so we all wish her well with the new challenges and new adventures. So, yep, thank you very much, Jane.
Just check. Anybody else want to say anything else before I hand over to Jane to acknowledge it?
I would just like, if I may, Chair, just like to say to Jane, thank you for answering all my daft questions with such clarity and with patience. It's been really helpful as a new member, both to the IJB and to this particular committee. And I can't thank you enough, because everything, although I like numbers, everything was explained very clearly and very easily. So that level of, that ability to be able to explain financial matters in particular is very rare. And I thank you for that. So thank you, and I wish you good luck in everything you do next.
Thank you, Sheila. And just before I hand over to Jane, I just want to comment. I really do like the use of the word persistent, Jackie. I think when you said it at first, I thought, should it not be constant? And then I thought, no, persistent's probably accurate. So I'll hand you over to Jane.
Thank you very much for your kind words. I'm moving on to a fantastic new role, but I am really going to miss the involvement that I've had with colleagues over the last 7 years in building what is now an effective working committee. I'm really proud of what we've achieved, and I'd like to take the opportunity to thank, first of all, my own team, Chris, Donna, who's not here today, Mark, and in particular Phil, who's stood by me and worked with me to support the chief officers over the last 7 years, and the chairs to build from scratch and build a really strong committee that's fulfilling its role. So thank you to Phil in particular. I'd like to thank my two previous chief officers and to Jackie, who have trusted me completely to establish the committee and to work with successive chairs to strengthen its role. Alongside the chief officers, I'd like to also thank the chairs, previous chairs and the current chair, who have all championed good governance and the critical role of audit, governance and risk in delivering the aims of the organisation. Finally, and they're not here today, I'd like to take the opportunity to thank my committee services colleagues, to Adam and to Scott, who have quietly ensured a professionalism and integrity has been brought to every meeting, and the officer team have been very, very grateful for the support that they've given us over the last 7 years. So if you can pass on my thanks to them, it's been very much appreciated. There are stormy waters undoubtedly lie ahead, and I wish Beth as chair and all of the committee all the very best. Good governance will support whatever lies ahead, and this committee's got a really, really important role to ensure that we carry on a journey of best practice governance in everything we do. So good luck with all of that, and thank you so much for your kind words.
Well, thank you, Jane. I'm sure we will have choppy waters and we'll be missing that persistence, but we certainly, I'll just finish by wishing you all the best, and we'll be able to see that again at the IJB meeting before you leave. But on behalf of this committee, thank you. So that's us finished for this morning. I'll be able to get to Tesco now. So thank you very much for your contribution, people, and we'll see you in January at the development event, and if not there, we'll see you in March. Thank you for your attendance.